That we discuss about the topic Erb Duchenne palsy, that is very important clinical. It is due to injury to superior root of brachial plexus C5 and C6 that will lead to paralysis of muscles of shoulder and arm, including deltoid, biceps brachialis, supraspinatus, and brachialis muscle. Supraspinatus is a muscle of rotator cuff, have a very crucial role in preventing dislocation of glenohumeral joint. Causes of Erb Duchenne palsy are during the delivery case. The angle between neck and shoulder is excessively increased, so it can lead to the Erb Duchenne palsy. Horse riding and motorcycle accident can also cause the Erb Duchenne palsy. Okay, so now we have a clinical presentation of Erb Duchenne palsy. First one is a adducted shoulder. The shoulder is moved away from the midline plane, as you can see in pic. Medially rotated arm, the arm is medially rotated, and the extended elbow, the elbow have extended configuration. Okay, now we will have a sensory loss. The sensory loss will be at lateral aspect of forearm. Okay, what is the mechanism of Erb Duchenne palsy? When a person hits a tree or ground, then stops, but head and trunk continue to move, then it can rupture or stretch the superior part of brachial plexus or avulse its roots from spinal cord. So it can lead to the Erb Duchenne palsy. So that was our today's lecture. I hope you have enjoyed it. Stay tuned with us for further lectures.